Hi, this is Michael P. Coleman, Content Director for Brother Be Well. Thanking you for checking out this series, this trauma and healing series brought to you by Blue Shield of California's Blue Sky Initiative. Hi, I'm Michael P. Coleman, Content Director for Brother Be Well. It's heartbreaking to contemplate that sometimes the most vulnerable among us, our children and youth, face extreme trauma. It's even more heartbreaking to realize that sometimes the perpetrator of the trauma isn't the stranger who we warn our kids about or the monster down the street or around the corner, but it's someone in his own family or circle of caregivers, one of the very people who have taken on the responsibility of caring for that young person. Those traumatic, adverse childhood experiences, if left unchecked and untreated, can set a child up for a lifetime of mental and physical health problems. Today, in one of a series of Brother Be Well conversations on trauma and healing, made possible by the generous support of Blue Shield of California's Blue Sky Initiative, we're speaking with marriage and family therapist and Brother Be Well clinical advisor, Christian Jacobs, about adverse childhood experiences, or ACEs. Christian, welcome back to Brother Be Well. How are you doing today?
Hi, how's it going, Michael? Thanks for having me.
Anytime. I always love to have you, even when we got topics like this to talk about. Let's get at it if you're ready.
Yes, I'm ready to roll.
Let's jump right into this, man. We've had several conversations about trauma during this trauma and healing series. Today, again, we're talking about ACEs. Those adverse childhood experiences are a little bit different than childhood trauma. Most children face childhood adversity, rather, but that's different from adverse childhood experiences. If you would, Christian, why don't you define for us briefly adverse childhood experiences?
Sure. Yeah. Well, actually, Michael, they're quite similar. Actually, they're in the same family. So just picture them as close cousins, or I should say, more of a cousin and the uncle, because you have that overarching view of the adversity, and under that adversity, you have the aces. So they're the same in a sense. So aces and childhood adversity go hand in hand. Childhood adversity is it's really a child's exposure to any abuse, such as some examples are emotional, physical, sexual neglect, also emotional and physical as well, and or actually family dysfunction or parent separation, divorce. I know we talked about in the past too on other podcasts, just how systemic racism and some of the police brutality have been some of those toxic stressor factors as well. Family violence is another one. Mental illness, also substance abuse and domestic violence within the family, or even like imprisonment as well. So adverse ACEs and adverse childhood experiences are really potentially traumatic events that really occur. This is really giving a good definition of it in summary, that occur when we're young, basically, before the age of 18. And it really refers to 10 categories that most practitioners really focus on, those adversities and experience by the age of 18. So some of those categories really look like the physical, emotional, and sexual abuse. That's one category. Actually, it's three categories they look at: physical and emotional neglect as well, mental illness, incarceration, intimate partner violence. So you have domestic violence is another crucial data point that they look at, and also parental separation, divorce, and also, as I said before, substance use or really substance dependence. So those are the 10 factors that ACEs really focuses on. And just to kind of really sum that all up, you're having the childhood adversity in general, and more specifically, ACEs really measures how that childhood adversity impacts a child.
I got it. I got it. I really appreciate that. I didn't realize they were part of the same family. And I like that you said one was the uncle of the other. So I really appreciate that. It's easy to keep it straight. Thanks, Christian. Let's take a look at some of the very strong data sets that I've learned about. There's a very strong correlation between ACEs and toxic stress. And that toxic stress is linked to chronic physical and mental health problems. Can you give us a summary of what some of those health problems are, Christian?
Yeah, and before I get into the correlation between toxic stress and chronic physical and mental health problems, I would like to mention the biggest correlation that really connects all these, right? And it's a correlation between high ACEs scores and life expectancy. So you're looking at the life expectancy of individuals really with a score of six or more by the age ACEs 19 years old is shorter than individuals with more. So you're looking at that age difference. That's 19 years taking off someone's life when they've had a higher score of six versus their counterparts. 19 years is a lot of time. So, and that score of a six is pretty high too. That says that a lot of toxic stress has gone into that person's life and they experience a lot of toxic stress. So, just to break it down a bit, because ACEs really does involve children, adolescents, school age, and up to 18 years old. For babies, key ACEs are associated with certain health conditions. So now we talked about this in some of the other podcasts in general, but now we can get more specific into it. Is failure to thrive. So that when that baby is from 0 to 5, there are a lot of failure to thrive issues that can be a challenge. Also, growth delays. And you're also looking at sleep disruption as well. So that sleep could be one of the issues too, and also developmental delays. So you're looking at a lot of developmental delays, whether that's learning disabilities or language disabilities as well. We get into older children, around 6 or 7 to 12, you're looking at increased risk for viral infections. So now the immune system is weakened. So now they're more susceptible to viral infections, which now we have COVID going on, right? Where having a strong immune system is very important. Pneumonia is also another one that's been proven to show a more of a impact in terms of asthma and other diseases such as your lung and respiratory diseases, and also difficulty learning and behavior as well. So in most of the adolescents, you deal with a lot of the somatic complaints like sleeping, things of that sort. You look at some of the paternity issues, teen pregnancy. So now you get more of the developmental, more of the social challenges that can occur. And then now you start to get into the substance use disorders as well. So youth are more likely to start using substances as well and being addicted to those substance use disorders. And adults, now we're looking at the more prominent conditions, right? We're looking at diabetes. You're looking at some of the depression and cancer, anxiety. So now these issues have manifested through their adulthood, and now they're coming out looking, and we can see how they're physically, how it's starting to affect them more. The PTSD and the chronic pain, and we talked about some of how arthritis can really manifest through mental health conditions. So those are some of the things that really can manifest from a baby all the way up to your adulthood.
So it sticks with you for a while, and you touched on a few that we've addressed in other podcasts. We're going to be producing pretty soon a session on that autoimmune response that can be triggered, and if it's not cut off, as I understand, which is often the case with chronic stress, it can really set up, as you just walked us through, a myriad of health problems, and some of them last a lifetime. I got to say, the life expectancy stuff kind of woke me up, Christian. I've got a pretty high ACEs score of my own, and we got to really check that and treat it and take care of ourselves and try to reverse some of those impacts, or we're not going to live the lives that we could ordinarily live. So really appreciate you walking us through that, man. Let's talk about some of your work. You're a very accomplished marriage and family therapist, and I'm wondering if you've treated children or adults who've been negatively impacted by ACEs exposure, like those exposures we've been talking about. We don't want any HIPAA violations here, but to the extent that can you take us to those front lines and talk about a consumer or two that you've treated, and how those adverse childhood experiences had set up problems, and then maybe how they were able to come out of the other side of that.
Sure. For the sake of confidentiality, I could share, and to be anonymous, I could share a few case studies without identifying anyone. But in my experience, what I've noticed is, working with children, adults who've been significantly impacted by toxic stress and who scored moderately. So a moderate score is 1 to 3. So a score in between 1 to 3 is a moderate score. A high risk is a score of 4 and up. And then it gets a little complicated because it can become if it's a score 1 through 3, but say they have pre-existing health conditions, that can it can potentially it can be scored as a high and not a moderate. And the same for a score, a level 4 score as well. So really, what really matters is what type of pre-existing physical conditions they have prior to receiving their score. That does play a factor. Having low levels of insight as to the significance of what they've experienced in life. So that's really been the main issue I've noticed, that many of the individuals I work with, there's little to no insight in terms of what they've been through. They don't see the impact of, or significance of how traumatic their environment was, or the experiences they've had in the past. And that's pretty much across the board. I don't think I've ever had anyone, maybe a few, come in and say, "Oh, well, this has really impacted me significantly, and this is how it's played a part in my life physically and emotionally." That's rare, which is why they're usually in therapy, to gain that insight. There's also a common theme of unawareness and the culmination of toxic events that occurred and how they may impact their mental and physical health. So it's really rare that they see how those issues have impacted their physical health. Usually, and even within the medical field, it's just now a new phenomenon to teach that mental health and physical health go hand in hand versus them being separate. And I know we talked about that in another podcast too. So, for example, I'll give you an example. I've treated children who've been, shuffled from several foster homes, right? And once they've been adopted or with a nurturing, care provider, they sometimes subconsciously, reject the care and love to developing an avoidance attachment style, due to years of rejection. An attachment style is basically how people bond in a relationship. They can be avoidant. They can be, they can attach to someone in an avoidance way. They can push someone away. There's different. They can be an anxiety type person where they feel high levels of anxiety when they're around. So most of these individuals are, they adopt this avoidance style due to years of rejection. Being in a home that's unstable. Food deprivation. Neglect and exposure to adults who have shown a lack of care for their lives. So even when they do come around a professional, such as like a social worker or a therapist or something, there's a lack of trust there because they're going to say, "How long are you going to be around for?" So these are some of the things I see, the common things I see working with these clients.
I appreciate you walking us through that, Christian. One thing comes to mind. One of the strengths of a platform like Brother Be Well is you realize pretty quickly you're not alone. And just really quickly, I remember when the first therapist of mine said to me, "You've been traumatized," and introduced me to. I was diagnosed as having PTSD based on adverse childhood experiences of my own, and I immediately pushed back exactly what you just described, and I said, "PTSD is for people in the armed services. That's for people on the front lines in a war." And the therapist repeated back the story I had just told and said, "Would you say that that wasn't a traumatic experience? Would you really think about it?" I had never even thought about it that way. And to this very moment, I thought I was alone in that everybody realized that. But based on what you just said, I'm absolutely not alone. And someone watching this is probably thinking the same thing. Gee, maybe there's something in my background that I need to pay attention to.
Yeah, and that's a coping mechanism, and again, your brain was trying to save you. It's trying to normalize your situation. It's trying to normalize and let you know, hey, this is normal. And it takes
Yeah.
someone to kind of come in and intervene and tell you what is normal and what could be traumatic. So yeah, you're absolutely right.
Powerful, powerful, powerful stuff. Let's take a look. Let's talk really briefly about the current ACEs screener. It identifies 10 experiences. You walked us through that are considered adverse. I've learned that, and this is by way of a website, childtrends.org, some of these data I'm going to give you. 1 in 10 children nationally has experienced 3 or more ACEs, placing them at high risk. You talked about that. Children of color, and especially Black, Latinx, and Asian and Pacific Islander kids, fare far worse than their white counterparts. 51% of Hispanic children have experienced at least one ACE. 61% of Black non-Hispanic kids have experienced at least one ACE, and that's compared to 40% of white non-Hispanic children and only 23% of Asian non-Hispanic kids. In most regions of the country, ACEs exposure is highest among Black non-Hispanic children. My question for you, Christian, can you touch on why ACEs are so prevalent in communities of color and especially in Black communities? And why should organizations who want to positively impact the overall health of those communities, why do those organizations need to really be paying attention, take a good look at ACEs?
Well, that's a powerful question, and I think it's a cyclical effect. We're looking at again what came first, the horse or the cart. Well, let's go back to those 10 categories, right? Then
Yep.
that ACEs considers when developing a score and correlate that, with the risk factors of toxic stress, right? So, which in turn significantly increases the ACE score. So, toxic stress is really a tribute to poverty, and these are those social determinants, right? That we talked about. Poverty, racism, discrimination, housing, food insecurity, and other health equity related social determinants. So as you see, we're looking at it, what desperate groups are most likely subject in this area. They're really subject to this attributes that we just listed. So people of color, they're especially African American and Latinos, we are exposed to these elements, right? And with a lack of educational resources at a much higher rate than whites, it's more difficult to get the proper information and the proper resources to really be educated on that. So, community business, to kind of go back to your question about, why is it important for these entities and these communities to really circle around this and take it, look at it closer. Community business organizations, public health institutions, and community leaders should really continue to really promote and utilize ACEs because it's really a good barometer to assess, folks in the community and to get them, the treatment they need. And it can also really be used as a prevention and early intervention tool, for the youth to identify earlier these issues earlier in life, because studies do show that once these issues are targeted earlier in the developmental process, it can prevent some of these health issues that we're talking about right now that can occur later in their adult life.